Ritvik Aryan of class 11 has asked a very pertinent questions related to stem cells on my education portal, that magnasedutech.org, and as well as on YouTube, that what are stem cells and what are the recent researches in the field of stem cells research in the medicines. Basically, we have to understand the concept of stem cells. Once the basics of the stem cells are clear, then definitely you will be in a better position to appreciate all the researches which are going on in the field of stem cells. Basic question is that what are stem cells? Stem cells are the cells that have not decided what they will be when they will grow up. Means they have not decided. Stem cells can grow up to be any cell in the body. So they are undifferentiated cells. No, undifferentiated. That is important word to understand. Undifferentiated cells. Like we are having that in the embryonic stage, what we are having that during fertilization, the ovum is there, and suppose this is the sperms are going. Okay. Then the fertilization is there. After fertilization, a zygote is being formed. Then the zygote will divide and they will form the mitotic divisions are still going on. Here the meiosis is there. Then after the zygote, the mitotic division and differentiation has started occurring. And the different type of cells these are being formed. And ultimately the cells are being formed in the blastocyst stage, like that, blastocyst stage. These are the undifferentiated cells. They are totipotent. Totipotent means they can take up the job in take up the job of multiple type of job, a specific type of job in course of development. So these are they can develop in the form of heart, they can become eye, they can become nerve cells, they can become red blood cells, like that. So they take up the job later on. So stem cells are the undifferentiated cells, which means that purpose of life has not yet been decided, not yet been determined, and subsequently they will take up the job, then they will become differentiated cells. Okay, you are having trillions of cells in your body that may perform different type of jobs. Like we have nerve cells, skin cells, heart cells. All the cells started their life earlier as stem cells during the embryonic stage. Once they picked up their job, they become differentiated cells. When you find the stem cells in human body, that in which phase of the life the stem cells are there, you are finding that stem cells are firstly at the embryonic stage. You have seen that embryonic stage, and we are finding that the stem cells during the adult stage also. Embryonic stage stem cells means they are inside the mother's womb, and adult stage which you may find in the bone marrow. In the bone marrow, we have seen that red blood cells are being formed, or blood cells are being formed in the bone marrow. In the bone marrow, they are the spongy material, they are the soft, they are inside the bone, and they are found in stem cells are found in other type of tissues also. But usually doctors are finding it more convenient to take out stem cells from the bone marrow because they are very much undifferentiated. So stem cells are of two types, embryonic stem cells and adult stem cells. So in the case of leukemia is what? The blood cancers. There are unchecked growth of the blood cells, and it is a type of blood cancer. So the stem cells are transplanted in the bone marrow, and this is a very important revolutionary field in the research in the field of bone marrow transplantation by stem cells. It has been successful also. The research into stem cells grew out of finding of the Ernest A. McCulloch, James E. Till in the University of Toronto in 1960, and after that a lot of research has come in offing. The stem cells can be used for the treatment of the various types of diseases. Here one thing is very important to understand, that from the embryonic stage, usually the doctors are taking the stem cells from the umbilical cord of the mother. Umbilical cords of the mothers. And from the, that the embryo gets its nourishment from the placenta in the mammals. From the placenta, the cells are in undifferentiated stages. We are taking the stem cells from that. Besides, the doctors are taking stem cells from the red bone marrow or from other type of the other adult tissues also. But during the treatment, there are certain disadvantages. Suppose we are transplanting stem cells in a patient's body. At that time, what happens? The body usually starts rejecting it because they find it as a foreign object. So the immunity of the body comes and attack on the foreign objects. So we require what? We require immunosuppressant. They suppress the immune system of the body, and after that we transplant the stem cells. Usually what happens when immunosuppressants are being used, then the patient's body are not having that much immunity, and in that case, if other infections are inside the body, then they will attack on the human body and they will cause certain diseases like tuberculosis and all such sort of infections which are present in the body, that has to be properly checked before the stem cell transplantation. Regarding the ethical implications, what Ritvik has asked, that ethical implications are there. Suppose like in the field of the clone research. In the clone, what we are doing, that a cell is being used, a single cell, for making the clone. Suppose stem cells are there, and after that we are using the totipotency of the cell and make the research with the clone, then a lot of other implications will come in the human life, in the human population. The ethical implications will be there. But at present we are finding that stem cells are being used for the use of the cardiovascular diseases. They are being used for the various organ disorders. In case of diabetes, they are like the deafness. Suppose if your teeth has to be extracted, it has been extracted, then you can use the stem cells for that. So a lot of research work is going on in the field of stem cells, and the basic concepts are these only.